It's one of the oldest programs in the university, and it's one of the signature programs. We have a large number of students, about 390 students total. And so there's a linkage of trying to continue to educate nurses to serve the citizens of Wilmington and the region. Nursing's always been a major important educational program in UNCW for Wilmington citizens.
UNCW is a great school. Its School of Nursing has a great reputation, and now with this new building and the sim lab, we get a lot of hands-on experience in the setting before you're pushed into the hospital, so you feel really prepared.
Essentially, we never had our own building. We were in Hoggard Hall, and about 5 years ago, we moved into Friday Annex, which was basically a very small building, and it was basically the faculty were housed there. We had a small computer lab and a small simulation lab, but students were spread throughout the campus. So this building really allows all of our students to be in one place with large simulation space and a large computer lab. So it's really an opportunity for students to be together in one location. I think the highlight is really the state-of-the-art simulation labs in which we can really educate students to see and participate in clinical scenarios that they may never experience in the hospital through the mannequins, and then being able to videotape them, play the video back to the students to get feedback. So it's another way of students to learn scenarios that they may never see in the clinical practice. Deliveries, myocardial infarctions, diabetic coma, seizures, etc. The new technologies that are in the building, the 8 simulation labs and the distance education classroom, because there's state-of-the-art technologies in this new building.
The students are going to work with a patient. His name is Vincent Brody. These are pre-developed simulations, and he's just come up from the emergency room. He's having some respiratory problems. He has chronic obstructive pulmonary disease, and so now he's up on the floor. The students are simulating their role as nurses.
99.1.
Go to 79. Is that good?
We're going to need to give him some oxygen to help raise his oxygen level.
Oxygen, please.
Is that starting to help some?
Yeah.
His oxygen saturation is 92.
Everyone call the doctor.
He's going to call the doctor.
This is Dr. Jones. Can I help you?
Yeah, or my chest x-ray, and you'll be up in 30.
That's correct. Thank you.
What did the doctor say?
I'm gonna call the lab, and we're gonna get some lab ABGs, and the portable chest x-ray is gonna come up, and that's just gonna take a picture of your chest. We're gonna draw some blood too.
In this particular scenario, they were very involved in communication with the anxious wife and also practicing their teaching skills, which is a major role that nurses have, is education of their patients. And then this particular child over here, he's one of our medium fidelity simulators, and he's called Vital Sim. And what that does is allow us to connect him to a little box, a computer, and we can give him vocal sounds. The students can actually obtain a blood pressure on him. We can pre-program it. They can listen to heart and lung sounds. This room is designed to be an OR / a trauma emergency room. This is a patient, he's having facial surgery, and this is a particular drape that would go on him. And we have instrument tables and Mayo stands. This is a room that we are still creating our vision for. We do have some partnerships with residents over at New Hanover Hospital. They come in and they use Noelle, our birthing mannequin, in the maternal infant room. And so we are looking to develop some partnerships where our students are also working with medical residents and learning that team approach that's so important in healthcare. We have 2 other labs across the hall that we could just do a walkthrough. This here is actually one of our hip task trainers, and so when students are learning how to give injections, they have to learn anatomical landmarks. They've had that in their A&P courses. So they come, and this is a buttock here, and they learn the location by palpating, and then we can help them understand. We can actually take our pelvic bone out and help them understand anatomically where they're giving the injection. The other lab is what we call our acute care lab, which is a 9-bed lab that simulates a typical hospital unit with 9 patient beds, a nurse's station. You'll see various equipment in there.
Well, I think that with the nursing shortage, there's an increasing demand to educate more nurses. So enrollment, there's a real demand for nursing education throughout the country and Wilmington as well. Also, this building is the beginning of a health quad on the UNCW campus. The next building will be psychology, and then there'll be an allied health building. So we're trying to grow health programs on campus. And so this is the first of one building for a footmark for healthcare on the campus.